So my name is Beth. I know quite a few of you because I grew up here in the Fletcher community, and I wanted to give you just a brief background on Ag Defense because I know quite a few people have not heard about us and have no idea what's going on and wonder why they're getting mail and seeing things about Ag Defense when they don't have cows. And so anyway, the long story shortened is that Ag Defense was created in 2018. I had been in insurance for a couple years, specifically crop insurance. So we did start as an ag company with a couple other agents. And we wanted to do something really unique and different with our agency. And so we created Ag Defense with the idea that eventually we would not be ag specific. We'd be a holistic insurance agency that could offer anything to anyone, no matter what walk of life they're in or industry, anything like that. So it took a while to kind of build that portfolio that we felt was strong enough to be able to market different types of insurance and be able to actually fulfill our promises. And so fast forward to 2020 and we were almost there, and then the pandemic hit and things got crazy. So fast forward just a little bit more and we're here now. We are almost completely full of everything we ever want to offer. And because of the timing of certain health insurance products, we really wanted to start these meetings ahead of time so that we could get the information out and we would be able to have conversations well ahead of deadline times, because nobody likes to work that quickly. And so that's why an ag company is having a steak dinner informational meeting about Medicare. I bet you never thought you would hear all those things in one sentence, but there you go. So anyway, the agency is made up of mostly independent agents from all across the region. We've got Oklahoma and Texas represented, but the agents that are local to our Elgin office are myself, my dad, Davey, and then Sherry and Sandra, who live just a few more minutes away, so they're not in as regularly. But anyway, so that's Ag Defense. That's why you see like the wheat and the cows and the farms. We started ag-based, but we had a vision of being a whole lot more. But we have a special place for agriculture in our hearts, and of course all of us came from rural backgrounds, and so even though we're not always going to be just for agriculture, we're always going to embody that work ethic. So we thought, even though we're going to be selling health insurance and life insurance and auto and home and things that aren't ag, everybody appreciates the work ethic that farmers and ranchers have, and especially since it's pretty much all of our backgrounds, we decided to go forward with kind of this image. So I'm going to let my dad take over. He's going to do the presentation on Medicare supplements, Medicare Advantage plans. This is just informational and educational, so we're not going to talk about specific prices. We're not handing out like pamphlets for certain plans, anything like that. That's all stuff that we can do if you're interested. The main goal of this meeting is to get the information in front of you so that maybe if you're approaching the age where this would pertain to you, it's time to start thinking about it. If you have been in one of these plans before and you just don't feel like it's a good fit, sometimes it's really helpful to hear the overall, like the 10,000-foot view of what they're all for. So anyway, that's who we are, what we do. Did I miss anything?
Prior to even beginning this, you may have some questions when we're done, and I may have to say, I can't answer that right now, and there will be two reasons why I might not be able to answer some of the questions you would have. One might be you may be asking something about the 2022 plan year that is not, nailed in stone yet. The other thing is the federal government has a branch that does Medicaid and Medicare, and they have some very strict guidelines about what you can do in a marketing meeting, which this is not, or an informational meeting, which this is. So this meeting is strictly to talk about general things, plan designs, not specific plans, not specific prices, not specific anything. I'll skirt the edge a little bit and try to answer some specific questions when I can, but if I feel like it's going to cross one of those lines, I don't have any desire to be in the crosshairs of the federal government for anything. So those things are usually best discussed, on a one-on-one meeting where you can answer, because not everybody wants to know everything that's going on with everyone in here anyhow. So if we stir up some curiosity and you want to know more about something, I'll answer it if I can. If not, we can certainly get together sometime, and I'll be glad to spend however much time is necessary to do that. We're gonna talk about Medicare in what I hope to be a way that any questions you might have in the future, you will know kind of where that question funnels back to. Which main part of Medicare does my question pertain to? And I think if you can leave here with a better idea about that when Joe Namath and J.J. Walker start their commercials again and run them almost, until 4th of July, you'll at least know, that might pertain to me, or that doesn't really even have anything to do with what I'm doing. And so I want to try to get a firm idea of what the different things are at a very basic level on Medicare, so that you can categorize things when you get something in the mail from AARP, or you see something on Facebook or on the internet, or you hear something on the television. So hopefully that will be one thing we accomplish. The other thing that would like to accomplish is, if for some reason you are at odds with where you are and you're wondering what options you might have, that you would walk away at least saying, okay, well, here's where I am, and I know what my options to this are. Now, you may not know price, you may not know every specific detail, but on a broad level, you say, okay, I'm here, and now I know I can go here if I want to, and I know when I need to think about doing that. So hopefully that's really about all we can do. The whole world of health insurance right now, and Medicare is no exception. It's like winding something up real tight that's got a big heavy spring in it, and something slips and you let go and it just goes everywhere. If we tried to address everything that had to do with Medicare tonight, everybody would walk out of here, myself included, just like spinning and saying, I don't even remember if the steak was good. I don't know why I came. So I don't want to give information overload, but just real useful, practical information that you can use to help guide your decisions, and then also to let you know that whether we're doing anything for you or not officially, we're always there to answer questions. And we feel like that's something that was needed in this area, both on the Medicare and on the regular health insurance side. There's lots of insurance agencies around, but none of them make a specialty of health insurance, and so a lot of people really are kind of dealing with a robocall, waiting on someone, press 4 for this computer voice or this computer. You just really can't talk to anybody. So we wanted to, establish ourselves as a place where people know they can go and get reliable information. What I've done all the way through this, I've kind of okay, great, thank you. I've got it color-coded red and green, and you're gonna find, if you're already in Medicare, you're gonna find that you're either in the red or the green. If you're looking at Medicare, you'll hopefully walk away knowing what red is, what green is, and basically what the differences are. So the four basic parts of Medicare are Medicare Part A, and that is hospital coverage. And Medicare Part A, when you go on to Medicare, does not cost you anything. You've been paying for the privilege to have hospitalization coverage all the time you've been working and paying into Social Security. So if you've got 10 years or 40 quarters of Social Security income, you get Medicare Part A at no cost to you. And it's basically hospitalization insurance. It has a deductible. I'm not exactly sure what 2022 is, but it was around $1,080, I think, last year. But it has a deductible for it. And so that's Part A of what's known as original Medicare, because this has been around since the beginning. Some things we're going to talk about are newer, and they're not original Medicare. Part B is your outpatient services, your doctor's calls, everything that's done outside of the outpatient ward in a hospital would fall into Medicare Part B. That also has a deductible. It's much smaller. It was like $180-something last year. but it also has a premium attached to it. That premium, if you make under $80,000 after you turn 65, is the same for everybody, and then it goes up a little incrementally as the incomes go up above 80,000. So people who earn more in retirement pay more for their Part B, but everyone that is under $80,000 will be a set premium, and that premium is pulled out of your Social Security check most of the time. There are certain circumstances where it's billed, but most of the time that's pulled out of your Social Security check. So, original Medicare is comprised of Part A and Part B. Part A being hospitalization, Part B being everything else. Okay, that part's pretty simple, right? The thing that is important to understand is that there are things in the payment of the bills for both Part A and Part B that are your responsibility, one being the deductible, and then there are some things like when you get to a hospitalization, you have a deductible per day for a room. When it comes to pints of blood, you get so many pints free, and then after that, it costs you so much, and so there are gaps in the coverage. Okay, it's not once you've paid your $180 Part B deductible and your Part A hospitalization, the Medicare is going to pay everything else. That's not the way it works. Even on the Part B, whoa, that went back off again. On the Part B, even the expenses that are paid at 80%. You have the other 20%. Okay, so there are a considerable number of gaps in the coverage. And so if you look down below that Part B, the supplemental plans, you've heard those called Medicare supplements. Another term for it is Medigap plans. So those are plans that you can buy, you pay the premium for it, and those gap plans pay for the things that Medicare covers but doesn't pay 100% of. Okay? Now the government they did a good thing. That's unusual, but the government did do a good thing on Medicare several years ago. I don't remember how long it's been, but they standardized the Medicare supplement plan so that it doesn't matter if you're looking at Aetna or Mutual of Omaha or Blue Cross and Blue Shield, if you have a Medicare G plan, every company's G plan covers the exact same thing. So it helps you to be able to kind of compare between companies. You're really comparing service and price. You're not comparing coverage with Medigap plans because they've been standardized. Okay? So for a large number of years, everyone who was on Medicare had Medicare Part A, Medicare Part B, and most people bought a Medicare supplement to pay for the things that Medicare approves the procedure but doesn't pay 100% of the bill. Okay? Now the Medicare gap plans are something we can't get into in much depth, but they're all different. Some of them pay both deductibles, some of them pay only one deductible, some of them say you pay the deductibles and we'll pay the 20% copay. There's lots of variations in those, so those would be the things that we would, or either you could come to us to talk about those one-on-one, or you could call someone else. You don't have to come to us, but you would need to explore the differences in premiums and the differences on what that Medigap plan does pay for you and which ones don't pay that. So it's kind of luckily there's some of the plans are not even available anymore. I think there's about 5 active plans that you can pick from, and so it's not that daunting of a task, but it's something that needs to be done. So if we were sitting here 15 years ago, that would be all we had to talk about Medicare. Okay, now enter Joe Namath and J.J. Walker and tons of paper and all that. The Part C, notice it's green. It is no longer original Medicare. It is still a Medicare regulated product, but it is not original Medicare. Okay, Part C is what's known as an Advantage plan. So if you hear the term Medicare Advantage, it's the green thing. It's the Part C. and it is a replacement for Parts A and B by a private company that is regulated by the government for what they have to pay, but what they pay and where they charge copays and deductibles is altogether different than Part A and B. Okay? Doesn't mean it's better, doesn't mean it's worse, it's just different. So if you are on original Medicare and you're contemplating going to a Medicare Advantage plan, that may very well be a good decision, but you need to know the lay of the land. And they have different plans too. So again, we can't really get specific. Even if it were okay, we really couldn't do that. There's too many different variations. And so where are you coming from? What are you thinking about going to? And what does that really look like would be kind of the discussion to have before making that change if you wanted to make that change. Okay? So Medicare Part C is a replacement plan administered by private insurance companies and overseen by the federal government. Now, a couple of things that are fair to point out and that I would want to know if I was sitting in your chair is that Medicare, original Medicare, you can go to any doctor, to any hospital that accepts Medicare assignment nationwide. That's about nearly 100% of the hospitals and about 95% of the doctors. So you have pretty free reign of where you go with original Medicare. Okay? The reason Part C plans can offer some other things that can definitely be advantages is that they restrict who you can see. There's two versions of Medicare Advantage plans. One is called a HMO, a health maintenance organization. That means you have to go to a doctor within that health maintenance organization, or pay larger deductibles or be referred out of the organization. So you don't have free reign to go wherever you want to go to get your treatments. But there could be some trade-offs that make that a very good thing for you, but you need to be aware of that. Then there is the PPO, preferred provider option on Advantage plans, which says you don't have to go necessarily to this one hospital or this one group of providers, but you do have to go into this network of providers. And if you go outside of the network, your out-of-pocket expense maximum can actually be about double what it is if you stay in the network. So, as is the case with almost anything, something that looks like it's a little better on the front end usually has some reasons why it looks better. And as long as you understand those reasons, if you decide to make a move, that's fine. But you want to be informed. You don't just want to say, hey, that sounds good. They'll come by and pick me up for my doctor's appointment. Let's change. There could be more to it that would make it something that is really, bottom line, not a good deal for you. So they're gaining in popularity, and they're gaining in popularity for a reason. That means they fit a lot of places. You just need to know if it fits you. If you're thinking about going from red to green, original Medicare to an Advantage plan. Does that make sense? Okay. And then Part D is for drug coverage. So Medicare Part A and Part B will cover your prescriptions while you're in the hospital, and it will cover outpatient prescriptions, and drugs, chemotherapy being one of those. That's a big deal. If you say, well, you're only covered for drugs in the hospital, what about chemotherapy? Well, that's an outpatient procedure, so that's covered under Part B. But when you get away from that, you get into just to regular prescription drugs that you take on a constant basis. Some are cheap, some are expensive. Those are not covered by Medicare A or B. So you have zero prescription drug coverage with A and B when you get outside of hospitalization or outpatient drug treatments. And so that becomes a choice that you, again, need to make is, do I want to pay for a Part D supplement that would pay for part of my prescription drugs? So on original Medicare, it's a separate supplement. On the green, if you notice that standalone for Part A and B, and the green, it's embedded into the Advantage plan most of the time. Okay, so the green Advantage plans cover hospital, outpatient, and prescription drugs. Okay? But we'll talk more about the prescription. There's caveat to the prescription drug deal that you need to be aware of too. But on a grand level, looking at it, overall, the 4 parts of Medicare, that's the 4 parts. And everything we talk about from this point forward flows back to one of these. Okay? Is that helpful a little bit? Okay, good. All right, well, let's turn the page. And there are some things that are key that you remember whether you're on red or green. And I learned a lot of this by helping my dad. I don't know if you saw him. He came and grabbed a steak and went home because he's been for 10 years. I've been telling him everything he needs to do. So he didn't need to hear all this because he's just going to call me anyway. But I've kind of made this kind of follow. I began to understand what it would be like to be on Medicare and not have a clue what a lot of this stuff is, and nobody to call except somebody in Philadelphia or Pakistan, one of the two. I don't know. But to not be able to get a hold of anyone, and so some of the things as I put this, kind of looking at it from a mega level, I wanted to have the things that are most important. And so on this, the key things to remember about services, and this is not as important on the Advantage plans because they kind of have got that kind of tightly regulated anyway, but it's still important there. But the first thing is if you're on original Medicare, you're on the red plan, when you go to do anything of any significance, you need to know that the physician and the facility accept Medicare. They're Medicare approved providers. Again, almost all hospitals are and most physicians are, but it is possible that you are checking into a doctor's office or to a facility that doesn't have anything to do with Medicare. Well, if they don't have anything to do with Medicare, Medicare don't have anything to do with them, who's going to pay that bill? You are. Okay, so ask. Y'all are a Medicare approved provider, right? Okay, you're a Medicare approved physician. Okay, we're going to send this out to a radiologist. I guess he takes Medicare assignment, right? Always ask, do they cooperate with Medicare? Because that is a big hurdle. If what you're doing is within the Medicare system, it all follows these rules. If it's outside the Medicare system, it doesn't follow these rules. So an important question to ask. If the physician, and then if you're on an Advantage plan, you can ask, you'll usually know, but is the physician or facility you're getting the service from part of the network? Not do they accept Medicare, but are they part of the network? If you're in a certain network, are they part of this network? And make sure that they are doing it, that they are within that plan, that network plan. Then number 3, you've gone from the facilities and the doctors. Now there are certain things Medicare does not cover. Okay, cosmetic surgery, unless it's the result of an injury or some other. If you just decide you want to have a nose job and you go get it done, Medicare does not pay anything on that. And we're going to talk a little more on that later. But if Medicare doesn't pay, neither does the supplement. If Medicare doesn't approve a procedure, then the supplement does not recognize that procedure. They work in unison. It does. The Medicare supplement's not going to come and pay something if Medicare says that's not even an approved Medicare expense. Okay? So you want to make sure that what you're fixing to have done is a Medicare approved expense. And you almost have to ask that to know for sure. You're fairly safe not asking, and if you're just really bashful and you're going in and it's just a X-ray, okay. But if you're fixing to go in and have a hip replacement, you want to ask that. I was a little surprised to learn the other day that even though Medicare does pay for flu vaccines, they don't pay for shingles vaccine. And so you don't. What seems to run down the same vein does not always run down the same vein. So you have to ask the questions. Okay, so remember to ask that. And then same thing if you're on the green, if you're on a Medicare Advantage plan, and you're in network, you've already asked up here, is the hospital in the network? Is the doctor in the network? Has this procedure been pre-certified? Because that's what they do to approve the procedure that's being done, is they pre-certify it. It's not like it's on Medicare's master list of things they pay for. It's your Advantage plans network and the list of things they pay for. Now they have to pay minimum what Medicare pays. So you're usually going to be pretty good, even if you accidentally ask, is this Medicare approved? If it's Medicare approved, then the plan is probably going to pre-certify it. But that question really needs to be asked differently in a Medicare Advantage plan. You want to ask if it's been pre-certified. Okay? All right, and then these last two they apply to both. If the service is ineligible due to the facility or the physician or the service, so if Medicare says we don't pay for it because you went to this hospital, or we don't pay for it because you went to this doctor, or we don't pay for it because we don't pay for that, then neither does your supplement plan.
Does that pay any supplement plan?
Yeah.
TRICARE?
TRICARE is a little different. It's a little different because it's got some. It's kind of like a mingled of the two. Yeah. So TRICARE will approve some things that Medicare doesn't pay for, but that's a rare exception in TRICARE. Medicare, same way. Medicaid, if you're on both Medicaid and Medicare, there's a few things that are paid for that wouldn't be paid for if you were just on one. But the overwhelming majority of things is going to fall under that rule. And then Part D, this is extremely important, especially if you are on some really high, some expensive drugs. And I mean, it almost, and it is criminal, but it's not against the law. Does that make sense? What is charged for some drugs just seems like it ought to be criminal. I know some people that are paying $15,000 a month for prescription drugs. So, you're probably not there. My parents have been really lucky. I think their total drug bill runs about $30, $40 a month, and they're 81 and 82 years old. Fortunate. But things can change, right? You can go from that, and then you go in and you have cancer surgery, and you get on some cancer drugs that run into that $2,000 a month or $5,000 a month or $15,000 a month. What do you do? So Part D has some really individual, I would call it individual twists and turns all its own. So on Part D prescription plans, which would be really part of the difference on one Medicare Advantage plan versus another is how they pay prescriptions. So the drug plans are different no matter where you look. And so for Part D prescription plans, whether they're supplemental, an original Medicare Part D supplement, or the Part D coverage embedded in an Advantage plan, either one of those, they are not the same. And so a word that many of you may already be familiar with, but if you're not, you probably need to at least file away in memory and say, oh yeah, I do remember hearing that. Formulary. A formulary is a system of taking the drugs that you're using for the coming year and saying, okay, which of these supplemental Part D plans cover that drug at all? Because some will and some won't. Which ones cover that drug with a small copay and a small deductible? Which ones cover it with a larger copay and a larger deductible? There are all kinds of variations, and the only way that you can really know if you're buying a drug plan that has the least out of pocket for you for the coming year is to run it through a formulary, which is where you send it to somebody who's got a kind of a database of all these plans, and they say, okay, here's this drug taken twice a day, this drug, this drug, this drug, and then it runs it through and it spits out and it says, okay, well, here's your premium here's 10 plans. Here's the 10 best plans. Here's the premium. Here's your deductible. Here's your copay. And so if you took exactly what you're taking now all year, this would be your bottom line out-of-pocket expense. And which one makes the most sense. And that's a formulary. And you have to do that every year because, one, your drugs may change. Two, your plan may change which drugs it covers year by year. or how they cover it year by year. So you could be taking, $10,000 a month worth of drugs this year, and you had very little out of pocket, and you're thrilled to death, and you say, I'm not about to change, only to find out January 5th when you go refill it that they're not covering that drug this year. Okay, so that's an important part, especially if you have high expenses on medicines, is you need to run a formulary every year. Now, do you know how to do that? Probably not. You can find places that will do it, and we're going to be at our office in Elgin, and we're happy to do that when the time comes. And so that is a very, very important part of Medicare, is to get the formulary matched up with the right plan for the coming year. Okay? So that very topic takes us to the third page, which is things that you need to remember about the annual enrollment period, which is the time that you can change your prescription drug plan. Once you start out in January, you cannot change for that year. Okay, so let's go back to our example of maybe a cancer treatment and then some really expensive drugs. Let's say that you're doing a formulary this year, or maybe you just choose not to even have a drug plan because you don't really have any prescriptions. You're fortunate, and that's okay. There are some penalties if you ever decide to buy one later, if you hold off and don't buy one, a Part D plan. But that may be a good trade. It's just something, again, that penalty is something you need to be aware of if you choose not to buy a drug plan. But there's drug plans that are pretty cheap, $12, $14 a month. And they wouldn't cover a lot on a really expensive drug, but they would do a pretty good job on most things. So a lot of people buy the cheap plan just to keep from incurring the penalty if they ever get on a more expensive drug. So let's say you have cancer surgery in November, and then you're put on a really expensive medicine in December. Well, for 1 month, you're going to have to pay for a lot of that medicine on your own, but then you run your stuff through a formulary, and January 1, you're on a plan that pays a lot more of it. But what if you have cancer treatment in January, and in February, here comes this high-dollar medicine? Well, you've got 11 months that you're just going to have to find a way to make it work. So there are risks to not carrying a pretty good drug plan that could catch you early in a year that could be financially, pretty tough on you by the end of the year when you could change to a better plan. It just, nobody can see into the future. Nobody knows if it's better to stay on a cheap one or go for the higher one. Again, that's just one of those things you want to walk into with your eyes open and say, I know this is cheap. I know it wouldn't pay a whole lot if I had, it's going to do a good job on, blood pressure medicine and stuff. It's going to do a great job on regular type medicines generally. But you get into a really, really high tier medicine, then some of those cheaper plans might not do quite so well. But you just have to make that decision, but be aware that every year you get a chance to change that. So the first one here, the red on your Parts A and B original Medicare, the annual enrollment period has nothing at all to do with that. Okay? So if you're on original Medicare, Part A and B, and you start getting stuff in the mail or you start seeing stuff on TV, that has nothing to do with your Part A and B coverage. They're mainly talking to people who have gone to Advantage plans as far as hospitalization or doctor's bills. Okay? There is an opt-in, opt-out date if someone decides they don't want to be in Part B Medicare, and they decide at some point they do want to now. There is a day that there's a period of time they can do that, but it's separate. It's not the same. It's not the annual enrollment period. Okay, so if you're on original Medicare, your Part A and B coverage has nothing to do with the annual enrollment period. It also has nothing to do with your Medigap plan or your Medicare supplement plan. If you bought a Plan G, if you're on original Medicare, Part A and B, and you're on a Plan G Medicare supplement, the annual enrollment period has nothing to do with that. You can change that plan anytime you want, but, hook, caveat, you have to be medically qualified to change a Medicare supplement plan. If you don't like your Medicare supplement plan and you want to go to a different one, you can't just change. You have to prove you're still insurable to change. So you have to answer health questions. You have to be approved by the company, and there's always that risk. And I have changed people before, but I hardly ever fall short of getting every medical record from every doctor you've seen and send it in with the application, because even if you do your best job to try to remember everything, sometimes you miss something, and then they come back and say, well, we're not covering this because we wasn't told about this, and had we known about this, we would have never issued this policy. So changing Medicare supplements is a little bit tricky. It can be done, and it can be done safely, but it's a little bit tricky. But open enrollment or annual enrollment has nothing to do with your supplement plan. Okay? So if you're on an A and B and got a Medicare supplement, those have nothing to do with the annual enrollment. Now, you can, the next one says that you can opt in or change your Part C, so your Advantage plan, including the Part D coverage in that plan each year during the annual enrollment period, and that would become effective January 1 of next year. That's the majority of the commercials you're going to be hearing about, is people who are either on A and B that are looking to go to a Plan C, an Advantage plan, or people who are on one Advantage plan and something has changed, maybe their drugs, now they want to change to a different Advantage plan for next year. That can be done with no pre-existing conditions during the annual enrollment period. So that all the buzz on TV is primarily about Plan C. However, if you have a Part D, so you notice that last line is back in red, that's back to original Medicare. Your Part D plan that covers your drugs, that annual enrollment period does apply to that. That's why you run the formulary, and if your great plan that covered your really high dollar medicine last year isn't covering it this year, it gives you a chance to find a company that is covering that medicine and change your plan for next year during the annual enrollment period. So, that's a lot of talking, I know. But it boils down to annual enrollment period only affects Advantage plans and Part D. So if you're on an Advantage plan or have a Part D supplement, you might need to do something during the annual enrollment period. If you're on Medicare A and B and a supplement and you're happy with that arrangement, the only thing you might want to do is change your prescription drug plan. And hardly any of the commercials, nothing you see really talks much about specifically the prescription drug. Okay? So, hopefully that gives you the ability to laugh at those commercials, but not take them seriously if you don't need to. But also to be able to laugh at that commercial and to take it seriously if you need to. But I just don't want you to be confused whether or not what they're saying has anything at all to do with you or not. Okay? So the last page is just how we want you to know that we're available to help. And we're not selling anything tonight, but we are promoting our service, because whether you ever buy anything from us or not, if you're like, I've seen people and they've got bills scattered out and they don't understand any of it, and they don't know most people like to pay their bills, but they don't want to pay a bill if they're not sure they owe it. And so if you find yourself overwhelmed with the mammoth amount of communication that you're getting and you just need someone other than someone you could talk to on the phone, our office is there and we will help you any way that we can, whether you're buying anything from us or not. Okay? So that's what we want to bring to the community. Now, do we hope that you do some business with us? Sure we do. But that's not a prerequisite on this Medicare supplement stuff. I've watched too many people suffer way too much anxiety over things that there's no way they can really fully understand it because they got nobody to talk to. And so we're here for you in that capacity, if nothing else. But if you want some guidance as you're moving into Medicare and say, well, I don't know if I really ought to do original or do the Advantage plan. I want to look at some options. We can show you options. We can answer questions. If you're wanting to make some changes to your Medicare supplement, and you think you're healthy enough to pick a different plan, and you want to look at a different plan and see if it would work better for you, we'll kind of show you the options, and I promise you, we will be overly cautious on how we answer the health questions to be sure that if you are accepted, that you're not going to have any surprises that someone comes back and said, we would have covered this, but we're not because we didn't know about this condition. We'll probably get a lot of people turned down because we're providing more information than they normally get, but we're not going to make the mistake of not giving them everything they need to make a decision that would result in no surprises for you. So we can help you do that. If you're wanting to look at an Advantage plan, whether you're already on an original Medicare or whether you're coming into it the first time, Beth is primarily going to be doing most of those Medicare Advantage things because there is a ton of paperwork and documentation that you've got to do to stay in compliance, and she's the one that has kind of a passion to get that done. I'm pretty aware of everything, but if I tried to keep all the ducks in a row for all the things that I touch on, I wouldn't be doing anything but going to school all day, and I wouldn't get to work with people. So I'm there for guidance and advice for the agents and to ask, off the wall questions or questions that maybe take a little more investigating to get to the bottom of. But Beth would be doing most of the Medicare Advantage work in the agency. During the annual enrollment period, we can assist you with reviewing current Advantage plans. So if you're just looking at, am I still on the best Part D plan or the best Advantage plan? We're good with that. We can help you with that. And then that last one, I guess, kind of goes back to the beginning. If you're just completely at odds with things that you've got that you think you need to do something with and you just don't really know what it is, box it up and bring it down to the office or put it on the kitchen table and call us, and we'll come out and we'll walk through it with you and try to give you some confidence that you're doing the right thing with what you've been struggling with.
I thought they weren't allowed to disqualify you for pre-existing conditions anymore.
That is true on Advantage plans and Part Ds. It's not true on supplements. It's true under Affordable Health Care Act on the out of Medicare, but there still is. You have to do that during the open enrollment period. They can't ask health questions there anymore either. The only place that when you get outside of we're going to do one meeting a week from Monday over Christian health share organizations, which have become really popular, and those Christian health share organizations still impose pre-existing conditions limitations, and so everything outside of the ACA, the Advantage plans, the Part D, and the original eligibility period. So when someone first turns 65, they can enroll from 3 months before they turn 65 until they're 65 and 3 months. In that period, you could be in the middle of heart transplant and leukemia treatments, and they got to take it. But if you let that open window go by, then you as far as the supplement goes, you're kind of you gotta live with what you can find.
Until next year.
Yeah, you would have to if you decided not to buy a supplement and you're 66 and now you've got congestive heart failure, you'd have to go to an Advantage plan to get any supplemental coverage. Medicare would still be fine, but if you didn't buy a supplement, you couldn't get a supplement a year down the road just because you say, hey, well, now that I got cancer, I think I'll buy a supplement. You can't do that.
When we first moved into the area, we were told that Humana was the only plan available.
On the Advantage plans?
Yes.
Okay.
In Comanche County.
That was true not too long ago. There's a few more now. There's still not as many here. You get closer to metropolitan areas, you get more options on the Advantage plans.
So there's more available now,
There is.
and there's a list of those somewhere.
There will be a list shortly of everybody who's going to be here, and it's one thing to say, like, for example, it sounds like United Healthcare is going to have Comanche County this year, but is United Health going to have one plan, or are they going to have 4, or are they going to have 8? Those things we'll know before open enrollment starts, before the annual enrollment period starts, but they keep those things real tight to the vest until the day of almost.
Well, they'll give you a chance to study it.
Well, they do, but you've got from October 10th to December the 7th. So, but for us that are in that business, for us to say, okay, this is the plan they're going to have and this is the price, to be able to say that right now is just, it can't be done because those aren't out yet.
Would that be around October?
Yeah, October, is it 1st or the 10th with the Met? Yeah, I think it's 1st through November 7th.
Yeah, that was a rude awakening.
Yeah.
That is the announcement of something.
That's when the open enrollment starts. All the plans that are available in every county would then have the information out for anyone that had the wherewithal to find it themselves on the internet or went to someone like Beth to get guided through it, and then those options would be there by then. And so there's back to kind of the need for the one-on-one. So let's say that someone, for example, was on a supplemental plan that not even offered anymore. They've got A through H now. Well, like Plan F isn't even offered anymore. A lot of people, if you have a Plan F, you can keep it, but they don't sell them anymore. So if you had a Plan F and you said, I really wish I had a Plan G, you could technically go onto a Advantage plan for 1 year because they give you 1 year to go back in and buy a supplement. But you have to go to the same carrier and the same plan if they offer it. If they don't offer it, then you can pick from the plan. So if a person was just really fed up with their Medicare supplement plan and they could live with being on an Advantage plan 1 year, they could go then back if that plan's not offered anymore, and then they could pick from their plan. So that's one example of where sitting down and talking about your individual deal would be necessary. Many of you have heard of the donut hole on prescriptions. Okay, that donut hole is much better now in 2022 because what basically the donut hole is, regardless of what plan you've got, it's like, imagine this big donut and there's a hole in the middle. Okay, you start in on this side of the donut and you've got coverage. Then once you've spent so much, you're in the donut hole. You don't have near as much coverage. You used to have to pay 75% of the cost of your drugs as you went through the donut hole. 2022, you're going to pay 25% of the cost as you go through the donut hole. So that's going to be a little better this year than it has been, but the donut hole is another unique animal that is all its own in Medicare. You don't have the donut hole in a regular health insurance program when you're not on Medicare and working at your employer or buying your own. There wasn't a donut hole, but some people don't know the donut hole exists until they're in it. So the reason a lot of people, like if they retire from the federal government or city or state, a lot of times they'll keep their plan at work. Sometimes that's a good decision. Sometimes it's not. It will generally only be a good decision if you've got massive prescription drugs that you're taking, because you can avoid the donut hole by staying on your employer's plan on the drugs. If it weren't for the drugs, then if you have to pay your cost of that after you retire, like teachers do, that cost might be, $1,200 a month. Well, that's not worth having the drug coverage because even the donut hole won't get you that bad. But that's a situation where if someone's retiring and they have the option of staying on their plan from work but paying their own premium or part of it, it's not a big math dilemma to sit down and kind of say, okay, now this doesn't mean it couldn't change in the future, but right now, if you took your plan at work and everything stayed about like it is, here would be your out-of-pocket per year, premiums, deductibles, co-pays, everything, and here's what this would be. It's just a math question when you get down to it.